Welcome to Oakwood's Champions of Care, brought to you by Oakwood Healthcare. My name is Mary Zatina. Today we're going to be talking about having a healthy pregnancy. Our purpose with this show is to give you complicated health information, but to make it simple for you to understand so you and your loved ones can live a healthy life. Today we'll talk about the things you need to do to get ready for a healthy pregnancy, some of those things to do while you're pregnant to stay healthy, and we'll also talk about high-risk pregnancies. With me in the studio today is Dr. Carol Baker. Dr. Baker, you're a family medicine physician practicing at Oakwood Healthcare in Westland. Welcome to the show.
Thank you.
Now, it's a rare treat for someone's primary care physician to deliver babies as well as deliver primary care, but you do that, is that correct?
I do.
And when one of your patients tells you that she's planning to start a family, what do you talk about?
I talk about just healthy behaviors for the most part. When somebody comes in planning to get pregnant, what it is that she needs to do to be sure that she's healthy enough to carry a pregnancy to term and has healthy habits.
So there's a notion about getting ready to get pregnant.
Absolutely.
And you said healthy habits. What are some of those healthy habits?
Eating right, eating regularly, having a healthy weight, exercising regularly I think is very important. Also not smoking, not drinking, no illegal drugs, and medication use. I usually go over any over-the-counter medications as well as any prescription medications that a woman may be taking that may interfere with pregnancy and need to be discussed.
Are there certain vitamins a woman should bulk up on before she gets pregnant?
Any woman who comes into my office talking about getting pregnant, I will put on prenatal vitamins, which are safe for women who are menstruating. And then also I offer her folic acid supplements as well as the prenatal vitamin.
Now, what is folic acid and what does it do?
Folic acid is a B vitamin, and it is in our food. Many grains are supplemented with folic acid these days, and the vitamin itself is crucial for closing of the neural tube, which will eventually become the spinal cord of the baby, and that closure happens nearly before a woman even finds out that she's pregnant. So before the missed period, if you don't supplement with folic acid, you may miss your opportunity to stop spina bifida from happening.
Wow, so that's really an important, is it a vitamin? It's a vitamin.
It's a vitamin.
Folic acid.
It's a vitamin.
Now you mentioned earlier about weight. You talked about weight and exercise being important. A lot of women I know think, oh, I'm going to gain a bunch of weight before or while I'm pregnant. Why lose it before? Because I'm going to have all that work to get the weight off after the baby.
My experience has shown that if a woman is near her ideal weight before pregnancy, all of that weight gain with pregnancy is easier resolved after pregnancy. She can lose that weight much easier if she has a healthy habit of exercise and eating right to not be over her ideal or near ideal body weight.
Now, if a woman is not so fortunate to have a primary care physician who delivers babies, such as you, she has to decide on who will deliver her baby, and she also has to decide where. Nowadays, a woman can pick the location where they want to have their baby. We want to show our viewers kind of a walking tour of the Oakwood Annapolis Birthing Unit. So let's take a look.
Questions that parents should ask when they're looking for a hospital to deliver is what benefits the hospitals have. Now here at Oakwood Annapolis, we do have a state-of-the-art center with electronic medical records and physician electronic order entry to help maintain patient safety. We also are part of the Keystone Initiative, which looks at continuing to maintain patient safety for both the care of the mom and the baby once they've delivered. Working with the staff at Annapolis is wonderful. It's a family atmosphere. Our Press Ganey scores have been over the 90th percentile for the whole year.
We are really proud of our rooms, and we have had patients comment that it looks, and they've had the experience like in a 5-star hotel.
The feel, you don't have, your typical busy hospital feel. It's more of a community hospital. It's more personal. The rooms are large. It can accommodate more family members. You labor, you deliver, and you stay in the same room the whole time you're here. We're not moving you from one place to another.
When we designed the rooms, we designed it into zones, and so there's a patient zone, the doctor zone, and the baby zone. And so when the patient comes in, we made the big wood cabinets, so it's a very nice environment when they walk in, and all the equipment is behind the doors. This is how we monitor the baby's heartbeat and whether the mom's having contractions or not. This is our blanket warmer that we have in every room. We keep our solutions in there. There's also diapers for after delivery for the baby. And also the moms really love it to have a warm blanket after delivery. It's a very nice place to have a baby, and I'm really proud of our team. We did receive a Service Excellence Award at the end of the year in 2010, and I think we got that because we do provide very good care and personalized care to our patients.
From my medical school through my residency and other training at other hospitals, this is the most beautiful hospital.
Dr. Baker, you have 3 children of your own, and I understand you delivered one of them. You had the baby. You didn't deliver your own baby,
right,
but you had the baby at Oakwood Annapolis's Birthing Center. Tell us about that.
It was really a wonderful experience. I had the comfort of my living room right there in the hospital with the safety of being in a hospital. The nursing staff was really very kind and helpful. Even with breastfeeding, they were very good. Having my first baby, it was a struggle. Learning curve is high. So we had really great care there.
Now, speaking of having a first baby, would you have any special tips for a woman having her first baby after age 35?
I do. I was over the age of 35, and my first tip is to go to your doctor sooner rather than later. There's special testing for genetics in pregnancy for a woman who's age 35 or over, and at the time of delivery, and that can be very important.
Dr. Baker, thank you so much for being here. Now, people who want to know more about you can find out how to contact you directly at oakwood.org, or they can call Oakwood at 1-800-543-WELL. And I want to thank you so much for being here today.
Thanks for having me.
When we return from a short break, we'll be talking with an Oakwood obstetrician about top tips for a healthy pregnancy once you find out you're pregnant.